Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Let's look into the spaces of the hand. So this includes the thenar space. What is thenar space? Thenar space is located under the lateral half of the hollow of the palm. So lateral half of the hollow of the palm, and it's continuous. That is the FPL and other flexor tendons of the index fingers. So it contains the FPL. So there is a FPL. Next is, it also contains the other flexor tendons of the index finger. Next is the extensions and the communications. Extension is proximally is limited to the anterior and the posterior. Posterior walls of the carpal tunnel. Then distally, if you see, it communicates with the first web space, and this is through the first lumbrical. Next is, what about the clinical correlation? It is in case of the infection, it is from the radial bursa or the synovial sheath of the index finger. The drainage is incision in the web space of the thumb. So web space of the thumb. Next is, we look at the mid-palmar space. So mid-palmar space is under the medial half of the hollow of the palm, and it contains the flexor tendons of the medial 3 digits. Now, what are the uses or the extension communications? It is proximally busy. Proximally, it continues with the forearm and space of paranoma. Forearm or space of the parona, and distal, what it contains? Distally, it is continuous. It is continuous with the medial 3 web spaces, and this is through the medial 3 lumbricals. Now, what is the correlation? Is that the infection, it is by the ulna bursa, and in the islets, the lumbrical canals are the outlets. So drainage, how do you have? Drainage is incision in medial 2 web spaces. And what are the other functions? The ulna bursa. The ulna bursa is common synovial flexor sheath. It's a common synovial flexor sheath, and it develops tendons of the FDS as well as the FBP. Now, this ulna bursa, it is proximally, it extends to the forearm and 2.5 centimeters proximal to the flexor retinaculum, FR. Next is distally, what is happening? So distally, it extends the palm to the midshaft of the metacarpals. So midshaft of the metacarpals, that is a MC. Then medially, it is continuous with the synovial sheath, continuous with the synovial sheath of the little finger. So proximally extends out to the forearm, 2.5 centimeter proximal to the flexor retinaculum. Medially continues with the synovial sheath of the little finger. So correlation is, there is a drainage, that is incision of the radial margin of the hypothenar eminence. Next is moving on to the radial bursa. So what's happening in the radial bursa is the synovial sheath, flexor sheath of the FPL. Then what happens? What happens in case of the extensions? The extension, there is proximally, it extends into the forearm, that is 2.5 centimeters proximal to the flexor retinaculum. And what happens distally? Distally, it is continuous with the distal synovial sheath. Continuous with distal synovial sheath. And this is of the thumb. So the correlation is, there is a drainage which is medial margin of the thenar eminence. Lastly, looking at the forearm space of the parana. So parana is the facial interval, below the flexor tendons. Next is of the distal part of the forearm. So how is it proximally and distally? So proximally, you see it is continuous with the intermuscular spaces, and this is nothing but of the forearm. And distally, how is it? distally it reaches the level of the wrist. Now what will be the clinical correlation? In case of infection, it is a ulna bursa, and looking at the drainage, it will include the vertical incision on the distal part of the forearm. To learn and grow daily like this, please do subscribe.